Hello everyone, my name is Fleur Pasman, Chief Operating Officer at Verdify. Years ago, I worked in the hospital as a clinical dietitian. I had a colleague called Dave. Dave treated cancer patients like Lucy with chemotherapy. Often Lucy would come to the hospital for treatment, but she was too weak to get her chemo. So Dave would have to send her home. For Dave, another wasted appointment. For Lucy, another dangerous delay. And once she did finally get the chemo, it was more toxic, so she felt extremely sick. Lucy suffered from malnutrition, and she's not alone. 70% of cancer patients are affected by malnutrition. Why could this happen? Partly the cancer, and partly the side effects of treatment. But all patients are different, and the same patient has different needs, day to day and week to week. One day Lucy had pain in her mouth. The other day she would completely lack appetite. Tailoring nutrition plans accordingly takes tools and it takes time. We had neither. That's why we at Verdify teamed up with Roche and we developed NoriMed. NoriMed is for people like Dave and me. We use it to prescribe evidence-based nutrition plans to our patients. They're based on their body measurements, diagnosis, comorbidities, drug use, nutritional status, blood values, personal preferences, and activity level. NoriMed deals with all these differences in just 1 minute. For Lucy, there's Nori, a digital personal nutrition guide with access to thousands of personal recipes. If she feels pain in her mouth, Nori takes away the ingredients that cause pain. If she loses her appetite, Nori suggests smaller meals. Nori helps her stick to her diet plan and maintain optimal nutrition status. And it's not just Lucy. Using NoriMed, Dave and I could provide nutrition support to many more patients much more effectively. What makes us think this will work? Well, it works already. Verdify uses meal personalization technology already successfully in food and retail. And it worked before with patients. The precursor of our platform helped patients with IBD and obesity. Today, NoriMed is being clinically validated in breast cancer. Our competition offers static meal plans. The NoriMed meal plans are dynamic. They can be tailored at any time during treatment, on demand, or even automatically. Because of this flexibility, it's easy to scale. If we can help cancer patients, imagine what we can do for those with obesity, diabetes, and heart disease. And that's our long-term goal. For each therapeutic domain, we look for a strategic partner. Together, we develop NoriMed, validate it, and commercialize it. So how do we make money? For healthcare institutions, we use a licensing model. They pay an entrance fee and additional costs for the number of patients onboarded. Therefore, we can give these patients access to Nori functionality at no cost. Access they keep, even after nutrition support ends. With these patients, we can run a longitudinal study. This will keep us ahead of competitors. And where are we now? This year, we focused on the development and validation. Next year, we will also move to commercialization. We have 2 important milestones: certification and 10 launching customers. By the end of next year, we'll have validated NoriMed as a product and as a business. Then we scale. Scale to other countries, scale to other domains, obesity, heart disease, diabetes. And at this point, we anticipate a Series A round. Behind NoriMed goes an ambitious team, all dedicated to bringing nutrition to the forefront of healthcare. We are supported by a team of experienced advisors from the field. NoriMed, nutrition management at the forefront of healthcare to get the most out of medicine. Thanks for having me.
I can start on this one. Looking at the field of nutrition, meal plans, nutritional advice, etc., the competitive field is very strong, and very vast in that sense. How do you address that, and how do you clearly differentiate from your competition?
Mm-hmm. Yeah, so I think it's really hard to distinguish nutrition, digital nutrition solutions as an outsider. I think what mainly distinguishes Norimed is that we're very focused on the clinical environment. So people that are ill suffer from one or many conditions. And then what makes us very unique in this field is that we can personalize according to dozens of parameters. The technology behind Norimed is, we developed it, I think we started 3 years ago or even longer. So we worked a long time on this technology. And today, I think we are the most advanced technology when it comes to personalizing nutrition plans. And that's exactly what is needed when you have these medical conditions, because as in the example from Lucy I was talking about, Lucy could have this issue today, and next week it could completely defer. And in the meantime, there is no support. For example, when I was a clinical dietitian, I would see Lucy 3 weeks after I saw her the first time, which means that in these 3 weeks, she might have lost many kilos of weight, which means that at the time she would visit the hospital again, her appointment would be cancelled, and that's pretty serious.
Okay, thank you.
Question for me, and maybe I missed that from the pitch, but I assume you don't integrate meal delivery as well, and if not, wouldn't it make sense in this case? Because I would assume like it would help you close the loop, and a lot of, let's say, cancer patients might not have the energy or support to prepare like nutritious meals for themselves.
Mm-hmm. Definitely, it's a great opportunity. So at the moment, we make sure that the content in the platform is tailored to its target group, so people with less energy and less time. But we also experimented with adding meal delivery services. And actually, next year in a roadmap, it's also part of the plan for obesity. I think later on the roadmap, this is something we will seriously consider and add.
Thank you.
Could you maybe go back to your business model, and if your long-term vision aims at expanding also these revenue generation streams?
Apologies, could you repeat the last part?
My question was around your long-term vision and whether you were going to explore other revenue generation streams through partners or other kinds of go-to-markets that you could explore.
Yes, I guess there are many opportunities. One, of course, is the meal delivery services, but there's also on the patient end a lot of opportunities. And I think what I was not referring to in my presentation, but what's also part of the long-term plan, is to get insurance companies cover for Nori, so patients could follow specific programs covered by insurance. And yeah, I think there are endless opportunities for partnering. Hope that answered your question.
It did, and maybe in the 30 last seconds regarding the pricing points at which you're selling your solution at.
So at the moment, we did market research together with our strategic partners, and I showed the average monthly price, which is 2,000 euros a month for a license for a healthcare institution. But it's based on a start fee or onboarding fee, and then on top of that, there are additional costs. So it really depends on the size of the organization, and then also on the number of therapeutic domains they would like to use Norimed in.